Sexual practices in Guinea Bissau. Guinea Bissau is a country located in West Africa. Guinea Bissau is bordered by Senegal to the north, Guinea to the south and east, and the Atlantic Ocean to the west. The country has a tropical climate with two main seasons: a dry season from November to May and a rainy season from June to October. Guinea Bissau has a diverse cultural heritage with over 20 ethnic groups. The official language is Portuguese, but many indigenous languages are also spoken. The country is rich in natural resources, including fish, timber, and minerals such as bauxite and phosphate. Sexual practices in Guinea-Bissau are shaped by cultural and traditional factors. Here are some sexual practices in Guinea-Bissau. 1. Female genital mutilation. Female genital mutilation, FGM, is a significant concern in Guinea-Bissau, where it is practiced according to UNICEF. Guinea-Bissau has one of the highest prevalence rates of FGM in West Africa, with approximately 45% of women and girls aged 15 to 49 having undergone FGM. Female genital mutilation is more prevalent in rural areas and among certain ethnic groups such as the Fula and Mandinka. Clitoridectomy is the most common type of FGM practiced in Guinea-Bissau, involving the partial or total removal of the clitoris. FGM can result in severe physical harm, including pain, bleeding, and infection. FGM can lead to psychological trauma, including anxiety, depression, and post-traumatic stress disorder (PTSD). FGM can increase the risk of obstetric complications, including prolonged labor, fetal distress, and maternal mortality. 2. Sexual violence. Sexual violence is a significant concern in Guinea-Bissau, where it affects many individuals, particularly women and girls. Guinea-Bissau has one of the highest rates of sexual violence in West Africa. Many cases of sexual violence go unreported due to social stigma, fear of retaliation, and lack of access to justice. Rape is a common form of sexual violence, often perpetrated by intimate partners, family members, or strangers. Domestic violence, including sexual violence, is widespread and often tolerated due to cultural and social norms. Sex workers, particularly women and girls, are vulnerable to sexual exploitation and abuse. Intimate partners, including husbands and boyfriends, are often perpetrators of sexual violence. Family members, including fathers, brothers, and uncles, can also perpetrate sexual violence. Sexual violence can result in physical harm, including injuries and sexually transmitted infections. Survivors of sexual violence often experience psychological trauma, including anxiety, depression, and post-traumatic stress disorder (PTSD). Survivors of sexual violence may face social stigma, leading to isolation and marginalization. 3. Arranged marriages. Arranged marriages are a common practice in Guinea-Bissau, particularly in rural areas and among certain ethnic groups. Arranged marriages are often seen as a way to strengthen family ties and secure alliances between families. Arranged marriages can provide economic stability, as families often exchange goods or services as part of the marriage arrangement. Arranged marriages can also enhance social status, particularly if the families involved are of high social standing. Individuals, especially females, may have limited choice in selecting their partner, which can lead to unhappy marriages. In some cases, individuals may be forced into arranged marriages against their will. Arranged marriages can sometimes result in early marriage, which can have negative consequences for girls' education and health. The Fula ethnic group, which is predominantly Muslim, practices arranged marriages as part of their cultural tradition. The Mandinka ethnic group also practices arranged marriages, often involving the exchange of goods or services. The Balanta ethnic group, which is predominantly animist, practices arranged marriages as part of their cultural tradition. 4. Polygamy. Polygamy is a complex and sensitive topic in Guinea-Bissau, where it is practiced by some ethnic groups. Polygamy is practiced by around 20 to 30% of the population, particularly among the Fula, Mandinka, and Balanta ethnic groups. Polygamy is more common in rural areas where traditional practices are more prevalent. The most common form of polygamy, where one man has multiple wives, Polygamy is seen as a way to maintain cultural and traditional practices. Polygamy can provide economic benefits as multiple wives can contribute to the household income. Polygamy can be a symbol of wealth and status. Polygamy can perpetuate gender inequality and limit women's economic and social opportunities. Polygamy can increase the risk of HIV/AIDS and other STIs. Polygamy can lead to conflicts over inheritance, child custody, and resource allocation. 5. Child marriage. Child marriage is a significant issue in Guinea-Bissau, with the country having one of the highest rates of child marriage in West Africa. According to reports, approximately 45% of women and girls aged 15 to 49 have undergone child marriage. Many families in Guinea-Bissau struggle with poverty, leading them to marry off their daughters at a young age to alleviate financial burdens. Child marriage is deeply rooted in some ethnic groups' cultural and traditional practices, making it challenging to eradicate. Limited access to education, particularly for girls, contributes to the persistence of child marriage. 6. Early sexual initiation. Early sexual initiation is a significant concern in Guinea-Bissau, where many young people initiate sex at a relatively early age. In some ethnic groups, early sexual initiation is seen as a rite of passage to adulthood. Limited access to comprehensive sex education and awareness about the risks associated with early sexual initiation. Young people may engage in transactional sex to support themselves or their families. Young people may feel pressure from peers to initiate sex at an early age. Additionally, these sexual practices are part of their cultural identity and heritage. Thanks for watching. Please do like and subscribe for more.